So what's the difference between a social worker and a nurse? Let's talk about the differences between those two different careers. I am a registered nurse and I have been since 2010, so I know a lot about the nursing role. The social work role, there are some similarities, and I've worked very closely with social workers as a nurse, but you definitely have some big differences, okay? So in terms of of both of these career options, there is a lot of flexibility. There's a lot of different places a social worker can work. So flexibility is definitely a bonus. They're also, can be very rewarding because you are really taking care of people in their time of need. And so there is that aspect where you feel like you're definitely making things better for people. So that's a similarity between both of them. And they also, though, can be both pretty high stress. You are dealing with people in very difficult times of their life in different ways. But it can be very high stress. You can have a lot of responsibility, and it can be difficult to manage. So those are some of the similarities that both of them have. In terms of nursing, when you have a nursing degree, you have a lot of opportunities to provide direct care to patients in a hospital. So you're physically caring for patients. You're, bathing them, you're giving them medications, you're walking them, you're educating them, you're assessing them, you're working with physicians to determine the best plan of care and implementing it. You can do that for the emergency department, the ICU, a regular nursing floor, in a nursing home, in a psychiatric facility. There's all those different places that you can provide this direct nursing care as a registered nurse. You can also be a school nurse, a community nurse. There's different ways that you can leverage that degree. Also, where you're not actually providing physical direct care, but you're kind of helping coordinate things. So a social worker, though, is different, but also lots of different options. You can work in a hospital as a medical social worker. So when I was working at the bedside and I would call the social worker, I would be calling them for issues like, I suspect abuse, or I suspect neglect, or I suspect the patient has told me I don't have a safe home I don't have a safe place to be discharged to, or I don't have the money to pay for my prescriptions, or I don't have a way to get home, or I do not have an address, or those kinds of things. These social issues, they help navigate those and coordinate care. A lot of times social workers in a hospital work very closely with case managers. And case managers, who are often nurses, are coordinating care and getting patients safely to nursing homes and rehab and those kinds of places. So the nurse, the case manager, and the social worker work very closely together in a hospital. So that would be a medical social worker. With a social work degree, you can actually provide therapy and counseling, so you can work in an outpatient setting as a counselor. Actually, my husband got his master's in professional counseling, but he considered getting his social work degree instead, because with this social work degree, you can provide counseling. And you have other options of what you can do as a social worker as well. But that's a really great feature of that degree, is being educated and being able to provide counseling. So you could work in an outpatient setting, you could work at an inpatient setting at a psychiatric facility. You could also work in a school as well as as a social worker. Keeping in mind, one of the challenging aspects of this is working and seeing some pretty awful things, some abuse, neglect, those kinds of things. That's a challenge that comes with being a social worker. Now, granted, as a nurse, you have different challenges, so it's not like those go away, but that is something that you would be seeing regularly in that position. So those are some of the differences between a social worker and a registered nurse. Both have those positives of flexibility and having a rewarding job, but also both have stress in different ways. I think that the things that you can consider if you're deciding between these careers is, do you want to provide direct care to patients, meaning you're physically providing that care, doing things like giving medications and performing assessments and working directly with physicians about the actual care that you're providing? Or do you want to be more on the side of things where you're providing maybe the therapy and the processing for people to get through pretty intense situations, the coordinating of care and coordinating of resources for people in need? Those social workers are the ones who are calling Child Protective Services, filing reports, following up on those kinds of things, working on plans to keep kids in the home and do what's best overall. So it's definitely a bigger picture than the 12-hour shift with a patient in a hospital or even at a different sort of facility. So those are some big differences and things to consider when you're deciding between which career path is really best for you. If you'd like to learn more about nursing, I talk a lot about it. I have a podcast where I dive deep into things that us as nurses in a hospital need to know to be successful. I'll have a link to that in the description of this video. I also have an email list where I talk about all things nursing as well, and you can sign up for that too. So thank you so much and stay fresh.